This presentation is on behalf of Group 3. Over the next few minutes, we'll be discussing access to essential medications, particularly public health policy pertaining to that access. Access to available, quality, affordable pharmaceuticals play a foundational role in ensuring the public health of Americans. However, according to a Gallup poll in 2019, 58 million Americans state they experienced medication insecurity or the inability to access and or pay for prescribed medications during that past year. Access to essential medications is a high priority healthcare need in the United States. Whether or not access to essential medications is a fundamental healthcare right has been debated for many years. Despite progress, lack of access to affordable prescription drugs remains a costly problem. The prevention and management of chronic diseases through effective medication-based treatment regimens is a foundation for any population-based healthcare initiative. The goal of this policy brief is to educate healthcare providers who are engaged in health advocacy at the federal level. In the most sweeping reform of the Medicare program since its inception, the Medicare Modernization Act established Medicare Part D, a prescription drug benefit. This voluntary benefit allowed Medicare recipients to receive basic pharmaceutical benefits by paying a monthly premium and a low deductible. The legislation also included provisions that would later prove costly. The Medicare Modernization Act prohibited CMS from negotiating drug prices or establishing a national formulary. In what became to be known as the donut hole, seniors were left with significant out-of-pocket costs once the Part D benefit reached its $2,400 per year limit. In 2007, nearly 1 in 3 Part D enrollees were affected by this coverage gap. This percentage trended down to 23% by 2016. This reduction was due in no small part to the Affordable Care Act, which was passed in March of 2010. One goal of this sweeping legislation was to phase out the prescription drug donut hole. Of course, the Affordable Care Act helped millions of Americans gain access to care, including prescription drugs, by expanding access to health insurance. The law provided health insurance subsidies for low-income Americans and created new health insurance markets from which health insurance plans could be purchased. Despite dramatically increasing the access to medications, the overall inflation rate for the most widely used prescription drugs continued to rise at levels well above broad measures of inflation. Despite efforts by both the U.S. House and Senate, including bills introduced in the recently concluded 116th Congress, no structural changes addressing access to essential medications have been signed into law. Failure of the federal government to address the issue of access to essential medications impacts access to care, the quality of medications, and the total cost of health care. In order to have access to pharmaceuticals, one must also have access to affordable health insurance and access to quality health care providers, which continues to be a barrier despite the establishment of the Patient Protection and Affordable Care Act. Approximately 45% of U.S. adults are inadequately assured, which is about the same prior to ACA. In 2019, 31 million Americans were uninsured and 40 million Americans were underinsured, and this continues to rise. 73.7% stated affordability was the cause. According to several studies, about 13 to 19% of available, accessible, essential medications are of low quality and are unsafe. The cost to the U.S. healthcare system due to access to affordable prescription medications is estimated $100 to $290 billion annually. This can be attributed to unmet healthcare needs, delays in receiving appropriate care, preventable hospitalizations, and financial hardships to patients. Patients with access to quality health care have better health outcomes, fewer disparities, lower mortality, and lower costs. One major question when seeking to improve access to essential medications is how can the government affect this issue? Before that question can be answered, though, it's important to establish a working understanding of what a solution needs to look like. According to an article by Azawa and others, there are 5 dimensions of key importance when discussing access to essential medications. Availability. Is there adequate supply of these necessary medications for all those that require it? Affordability. Are they available at a price point that is not socioeconomically exclusive? Accessibility. Are they equally available in all geographic locations? Acceptability. Is the medication, as it is made available, delivered in a way that doesn't hinder adherence? And quality. Are the products available of acceptable quality to effectively treat disease? Ideally, comprehensive legislation would address all 5 of these dimensions, though currently many bills tend to focus on certain elements individually. One such bill that seeks to address the affordability aspect of essential medication access is Senate Bill S-1801, otherwise known as the Affordable Medications Act. This bill was initially introduced to the 116th Congress in 2019, but was ultimately referred to the Senate Committee of Finance without a vote. The purpose statement written into this bill is very succinct: to ensure medications are affordable. The bill seeks to achieve this affordability by initiating improvements in the areas of pricing transparency, access and affordability, innovation, and choice and competition. How this bill plans to make improvement in the four areas deserves some elaboration. The first is transparency. This bill plans to increase pricing transparency through increased reporting requirements for pharmaceutical companies and nonprofit patient assistance programs and disclosure of acquisition prices. The second is access and affordability. This bill would require price negotiation under Medicare and Medicaid and requires the provision of manufacturer rebates to certain low-income individuals. It also decreases the requirements for cost sharing under qualified and group health plans and modifies requirements for importation and trade. The third area is innovation. This bill establishes an Antibiotics Innovation Incentive Fund and an NIH Center for Clinical Research that is dedicated to medication innovation in areas of pricing and delivery. This center would be specifically tasked with performing a research study that examines funding and finance mechanisms to enhance research into methods to disconnect development costs from product pricing. And finally, the last area of focus under this bill is choice and competition. They seek to enhance this choice and competition by creating an FDA database of generic medications, limiting the time of drug exclusivity, and modifying provisions related to advertising and patient infringement. Now, broad sweeping legislation such as this begs the question of how and who would be paying for this. Since the bill's been referred to the Senate Finance Committee, it's still unclear by what means its costs are going to be met. It is written into the bill that non-compliance fines would be redistributed to the program, but that is hardly enough to cover the expense. There's already $1 billion annually appropriated for fiscal years 2020 to 2030 for the establishment and maintenance of a center of clinical research. There would also need to be $3 million of additional funding for the previously mentioned NIH study, along with another $2 billion credited to the Antibiotic Innovation Fund. One could speculate that funding would require reappropriation of funds from other programs or some type of additional tax expenditure, but that information is not outlined in the text of the bill. As with any piece of legislation, unintended consequences are possible. The experience of other nations who have expanded access to essential medications may be helpful. The business model of pharmaceutical companies has historically relied upon the American consumer to provide a profit. Unintended consequences of National Pharmacare program include pharmaceutical companies would lose incentives for research. It would be difficult for them to recoup costs of research and development if the cost of prescriptions is limited. A pharma program could prevent access to valuable and innovative medicines or technologies. It could also result in a loss of incentive for innovation. Canada's attempt to do this resulted in inquiry and consensus that were concerns that implementation of National Pharmacare could delay the introduction of some pharmaceutical products in the Canadian market. Another unintended consequence is that physicians could potentially shift their area of focus to something more profitable. Finally, retailers could raise costs in other areas to offset profit margins. Unintended consequences may also be present in the terms of cost. As the saying goes, nothing is truly free. A national pharma program could complicate delivery of services without adding value for patients. A national drug plan would require significant administrative coordination across providers and add complexity to the existing system, potentially without providing significant benefit. The plan can also be very expensive. Given the tremendous administrative cost of consolidating pharmaceutical benefits into a national pharmacare program, it's unlikely that the estimated cost savings could be realized. Opponents of the plan will surely ask, how much will it cost to implement a national prescription drug plan? The true tax burden of the plan should be calculated and transparently presented. It should be recognized that drug shortages and reduced access may result from such a national policy. Drugs not included in the program will likely cost more. Surgery charges could increase to offset drug charges. A national pharmacare program could also offer little incentive for rural pharmacies, which could limit access to medications for some citizens. So who exactly will bear the cost of new prescription drug coverage? In addition to patients and big pharma, the costs of a national pharmacare program would be borne by taxpayers, all levels of government, communities, physicians, and small businesses. Despite these risks, it cannot be denied that the cost of inaction is the continued health of our nation. Any proposed legislation seeking to expand access to essential medications will draw reliable supporters and detractors. In October 2020, a majority of 58% of the public said they do not want to see the Supreme Court overturn the Affordable Care Act, which, by expanding access to health insurance, increased access to medications. 8 in 10 Americans polled was against overturning protections for people with pre-existing chronic conditions. Democrats at the national level have also been reliable supporters of expanding access to care. As of 2020, 86% of Democrats supported health care reforms. Expanded access to care also has garnered support from 20% of Republicans. Finally, healthcare professionals and the professional organizations to which they belong are reliable supporters of healthcare reforms. Among the stakeholders who would strongly oppose healthcare reforms, such as efforts to reduce the cost of prescription drugs, are drug companies and some health insurance providers. Republicans have historically opposed healthcare reform, with 76% of Republicans saying they would like to overturn the Affordable Care Act. A minority of Democrats, especially moderates in conservative districts or states, may oppose ambitious attempts at major structural change in the financing of healthcare. Finally, professional groups that benefit from big pharma would likely oppose legislative efforts to address the affordability of prescription drugs. There's an urgent need for advocacy among healthcare providers seeking to improve the health of their patients. Almost 75% of primary care and hospital outpatient visits result in medication therapy. Non-optimized medication therapy and the ability of patients to follow prescribed pathways results in avoidable morbidity and mortality. Resulting treatment failure and chronic medical issues add additional health-related costs. An estimated annual cost of non-optimized medication therapy in the United States was over $528 billion in 2016. Even with the legislative changes introduced by the Affordable Care Act, inappropriate access to medications still exists. A 2016 Commonwealth Fund International Health Policy Survey found that approximately 14% of insured U.S. patients failed to fill prescriptions or skipped medication doses due to cost. The results for uninsured Americans was even higher, at an alarming 33%, who would either did not fill their prescriptions or skip doses to reduce costs. U.S. patients who underutilize medications have higher complication rates, adding an additional $100 to $290 billion in estimated annual healthcare costs. Given that medication regimens are an essential to treating most chronic health conditions, failure to act leads to unnecessary human suffering. As previously stated, the purpose of the Affordable Medication Act is concise: to ensure that medications are affordable. It seeks to accomplish this goal by addressing many of the 5 dimensions of access to essential medications. Contact your U.S. congressional representative, your U.S. senators, and your professional organizations that engage in advocacy and/or lobbying. Ask them to help improve the health of our nation by improving access to essential medication. Thank you.